participants already, so we're doing
Right.
well.
Right. Straight A students. Jim, I will post all the links that you sent twice, okay? In
That's
the
fine.
beginning. Okay, and then somewhere in the middle of our meeting so that more people see them.
Excellent.
Okay. In 1 more minute probably and we will start.
Пані Оксано, вітаю.
Да, добрий день. Вечір вже.
Greetings. Good
Чути добре,
evening.
так? Можна так.
Да, да.
Good evening.
Good evening. А скажіть, чи моє ім'я там українською чи латиницею? Щось я його не знаю.
Українською.
So my
Українською
name
ваше ім'я. Ну, принаймні у мене.
Почти всі хто.
Да, да, перейменуйтесь, будь ласка.
I did not hear from Kurt West, and I don't see him on. I don't know whether there's something you want to say at the beginning.
It's 3 minutes past 6 our time, so probably we may start.
Okay.
Mhm.
Good evening, everyone. This is Jim Martin in the United States, along with Carla Castro. We're thrilled that we can again today meet with all of you and talk about some opportunities to record and share experiences that you've been having in Ukraine as your efforts to support your service members and their families continue. I'm not sure how best to pick up this morning, but it would be great to begin by hearing from any of you who have either thought about a case study or other publications that you may have underway, and we can just go from there. Kyle, is there anything you want to add to that?
Yeah, Jim, I just one good evening, everyone. And as you know, it's morning in the United States, but I know it's evening, and we do appreciate everyone using their evening hours to join us. I know many of you have submitted um, titles and possibly even abstracts to the special issue that Dr. Amy Adler and Dr. Boy are organizing. And I just want you to know that even if you haven't submitted anything for that particular project, there are going to be other opportunities. Uh, and there are other opportunities to submit papers to other journals. So even though you may have missed that very short deadline that we had to submit something for the special issue in military psychology, there are other journals that love to publish case studies at both the clinical level, leader level, and the organizational level in non-psychology journals. So please just keep that in mind. And the offer I made 2 weeks ago still stands if anyone would like me to take a look at what they're thinking about or review what they've written, because I realize that writing in English can be very difficult. It's difficult for me, and I grew up writing English. So please do not hesitate to send me what you have, and I'll be happy to work with you to make sure that it's, written in a sort of American scientific language, if that makes sense. So I just want to again put that offer on the table. So Jim, back to you.
There are going to be a couple of postings in the chat this evening of other opportunities that I'm aware of for English-speaking journals. And I would add to Kyle's comment, I'm more than willing to be of assist if anyone would like a review or comments or help. Glad to do that. And as we find more opportunities, we will continue to share them with all of you. I think it's critical, and just my last remark at the moment, but I think it's critical to try to capture some of the experiences that have occurred in Ukraine and things that you can share with others internationally that can help prepare and support other countries as they engage in conflict. So looking forward for any opportunity to be of help. So let me turn this back to maybe one of our Ukrainian seminar leaders who might want to comment as well about the importance of publications and publication opportunities.
Ірино, прошу.
Iryna, please.
Доброго вечора всім. Я
Good evening, everybody.
помічаю, що дуже багато людей з виключеними камерами.
I notice that many people
Я думаю,
don't
чи є для цього
turn their
сьогодні якась
cameras on.
особлива причина,
Do we have a special reason for that today?
можливо, хтось, хто не може включити камери.
Or
Доброго
maybe we have
вечора,
people
пане
who
Сергію,
are
дякую,
not
що вимкнули
able
камеру.
to work their cameras. Thank you, Sergey.
Можливо, ви можете в чаті написати також
Maybe you can send us
про,
a
якщо ви не можете включити камеру.
message in the chat
Завжди приємно
if you
спілкуватися
can't use your camera. But
з
it's
колегами,
always
яких ми
pleasing
бачимо.
to
Але
have a
я
conversation with the
можливо,
colleagues that we can see. Of course, I understand that you may have some particular circumstances when it's not possible to use your camera. Thank you. I would like to once again emphasize on this unique opportunity to get the support and feedback. So, in this enabling environment, because it's not always possible. Unfortunately, the English language publications about the experience that we are getting are not sufficient. They are limited in number, and very often we see that our publications get feedback from the reviewers stating that many improvements are necessary. And such bad feedback could have been avoided if we had engaged our colleagues at the stage of idea. So I'm encouraging everybody, if you are planning, well, if you would like to participate in this collaboration, please use this opportunity. Also, we have created a link that can make your life easier and simplifies the process.
Вітаю, друзі, радий
Greetings, dear friends.
бачити.
I'm happy to hear you and to see you. Jim, Iryna,
Щодо ремарка щодо виключених камер.
a small comment about
Не думаю,
the
що так прямо
cameras.
якась особлива сьогодні день, але
I don't think that this is a special day today, but from my personal experience, I can say that very often on Friday evening we have an opportunity to listen to the seminar, but sometimes people are traveling in this particular time and they are not able to use their cameras. But Anyway, I agree with you that it's much more pleasant when people open their cameras. As for the publications, among the people we know, we have seen a very big interest towards this special issue of the military psychology. And it looks like many people, many authors have applied, of those who would like to do it and who have prepared an abstract. And it looks like we have an active response. So our next step will be to prepare the abstract by the end of the month. And the link that we have posted today, this is an additional option that we started on the previous time, because we didn't want to mix two tasks. And this additional option, from the point of view that Carl mentioned about the case study, if we have clinical cases or situations that you see as unique or as cases characteristic of some trend, and if you think it makes sense to analyze them using the case study approach. Of course, if we look at the single case, this is not a population research, this is not a statistical thing, but this case can demonstrate some new things that we are facing, or maybe a new trend that looks new to you, or maybe this case is a difficult one, or maybe you have suggested a special solution for this case. So you can use several principles to bring up your case for discussion. In the previous seminar, we had a very good introductory lecture about the principles of the approach. You can watch the record of our previous meeting, and together with colleagues, Andriy Karachevsky, we are here. Maybe Andriy would like to add something. Thanks to Andriy for being so proactive in this issue. We have prepared a form. Of course, it's not ideal. It has some room for improvements, but it simplifies the procedure of registering a case and getting feedback from international experts. We will think how to make these results available so that you can see the results. Our international experts and national experts could have a look at your results and suggest some improvements if necessary, and suggest the place of publication for discussion. Of course, the cases have to be anonymized if this is a clinical case of a specific military staff member or a patient, or if this case is related to a group, it also has to be anonymized, so that other people would not be able to identify the unit name or the location. You can provide a Ukrainian version, and we will be able to help you with translation. The idea is to have as much discussions as possible for interesting clinical cases. Andriy, are you here?
Andriy, maybe the floor is yours. Well, I'm still continue with my other job, my day job. So the form of our chat, I presented in the chat. So if you want to check it out, check the chat. And if you want to share any of your case, and it could be not only the case that have like difficult client, but it could be even work with units. I know that we can have a lot of interesting cases during the work with the unit that could be above the traditional imaging cases if you compare them to the general situation and considering our difficult conditions. And it could be very interesting, not only for the person who present his case, but also for those who would read it and then discuss it. Thank you. And now we have this pause and everybody is waiting who is next. When the case will be presented. But maybe it's not necessary to record this case. Maybe if some participant want to share their case, and we can even not record that about what had happened, and maybe we can discuss if this case could be published later in the future. So please raise your hands and Oksana will be our moderator. So please, Andriy, the floor is over to you. I have a question. I work with diagnostics and therapeutic effect of mobile application that estimate psychological state of the person according his or her voice. If it's possible to bring up this case for publication, it's like a short article. It would not be annotation, but it's not full article. Are you gonna present some case and the work of this method on this case, or you have several cases? So this is a group. This is a group of military students who've been working with, and we have some results, like some previous research. Can I share this case, or also will you be? Is it going to be interesting for our project? Of course, it will be interesting. And did you apply in this special edition? Yes, I already applied, but I didn't get any feedback. I've sent it to 2 emails. The name of my article, of my work, but I didn't get any feedback or any reply whatsoever. Probably not all the emails were proceeded. We can ask Carl if he saw this article. I've sent the email on January 30.
Comment, please, on this question.
Can I ask, did you send it to me?
1 second, please. I will look at the names of email. I give you answer, okay? 1 second, please.
I didn't receive anything. So if anyone sent anything to me.
I sent Peterson free and UTHSCSA edu. Peterson free.
Let me jump in for a second. I would assume that the submissions that have been sent have been many, and that the people at the journal have not had a chance to process all of these yet. So that it may be a while before they're able to do all of that.
And Jim, they are not going to provide feedback. All they're going to do is say yes, no.
That's what I mean. That's what I mean by
So
feedback.
I put
Acknowledgement.
I put my email in the chat. So if anyone wants me to review and provide feedback, I'm happy to do that. But if you just send it to the journal, they are not going to say, oh, we like this, consider making these changes, consider making those changes. They're just going to say, no, we don't want a paper. Yes, it is a full paper. That's all you get.
Okay.
But that's going to be based on the abstract, not on the title. So get the abstract, and then you'll get told yes or no.
Okay, thank you. Okay. So it's all. Thank you. I will send you, and when I will receive feedback, we continue discuss. Okay.
Yes, Kurt, go ahead, please.
Hi, everybody. I was just going to, I'm not part of the editorial group that's putting together the special issue. But I thought I might offer some, I guess, this is my own personal opinion of topics that I would find interesting to hear about from perhaps the perspective of the people who are in this room, some at least. But just some topics as you're thinking about, well, what should I write about? So things that I would personally find of interest. Anything that you have seen or worked on in helping soldiers respond to or sort of sustain their well-being when they can't get to medical assistance right away. So things that are helpful to soldiers when they're far away from medical assistance that will help sustain them. Any thoughts or observations on how you work with service members who are struggling with their own battlefield stress and also having to think about or manage the fears of threat to their loved ones? Anyone who has worked in any capacity in training medics in psychological health skills, those would be very interesting. Anybody who has thought about or worked in helping soldiers manage the stress of novel or new threats, things that they haven't encountered before that they have to then react to. I'll stop there.
All right, let me just, I guess, add beyond just this special issue, other publication opportunities. There are clearly other broad issues that may be evolving in the war, and that all of these individuals may have some insight to, whether they relate to policy or maybe they relate to family or community issues. But aside from this special issue, other publications would be very interested in the experience that is occurring within Ukraine. So I hope others here who may be on the webinar, who may not work with soldiers directly, but may be working with families or in communities, may feel that there are opportunities for publication as well. Oksana, can we see if we can encourage maybe some discussion among participants this evening about things that they've either submitted that they'd like to talk a little bit about, or ideas that they are thinking in the future might be useful for publication. So maybe you could help facilitate that conversation.
Колеги, якщо є якісь ідеї і ви сумніваєтесь, правда, чи це може бути
Colleagues, if you have any ideas and you have any doubts about the publications or the form of the publication, if you have any question, please ask us. We have this opportunity, really cool opportunity today. Iryna, over to you. Yes, I'm very glad to hear that there are lots of participants who want to do it, and I would like to use this opportunity, which is quite rare, to raise the topic about the moral trauma during the organization of the webinars. We already did 3 webinars. There we invited our international and national colleagues, and I noticed that this topic is quite difficult. Maybe something has changed because we did it for some times ago. I think it was 6 or 8 months ago. So, and I would like to hear some feedback from my colleague who work on this topic in Ukraine. But I noticed that this topic is very difficult because this experience is very theoretical, because we know what is it, we understand it, but it's not diagnosis. There are no criteria how to assess it, and there are no specific ways to treat it. And then the question is like, why do we need it to work with it? So this is the first part about the relevance of this discussion. And the second part is about the fact that we are trying to find the data to estimate the psychometric and we are trying to work with the assessment made by Jewish Courier. We already translated it into Ukrainian. And I have a question. Can we think of any different avatars of moral harm in different population groups? I know that there was a lot of researches in US on military who were sent to Afghanistan or Iraq. What do you mean by saying avatar? Avatar is like a representative of trauma in different population groups. We had this term since 2015 or what? Or do you mean that we were calling in 2015? Probably no. I think it's not the one that you think. This is like some clinical term, you know?
So after we saw the movie, there were the strange people. So in the army, people who are alcohol addicts are called avatars because their skin is blue. And also there is a British development called avatar therapy. It's more linked to psychosis. No, I mean rather some clinical profile or representation of moral damage among different groups of population, taking into account our context and comparing with other contexts and other peculiarities of military activities and the scale and so on. It's interesting to hear your opinion. Maybe our colleagues Carl and Jim, did you ever see any descriptions of like that? And the third question, how it would be rational to plan such a research from the scientific point of view? If we were to compare this, how could we do it? Thank you.
Так, Андрій, прошу.
Yes, Andrei, please. Once again, if we are talking about the requests, it would be interesting. Maybe somebody would like to join the discussion of diagnostic questions. No, we don't have this opportunity, especially for the military staff members who are participating in the military activities in action, and for those who are returning for rotation from deployment. The questionnaires that are usually used are not representative. They do not show, sometimes, well, sometimes they do, but often those questionnaires are not relevant for adequate screening, and they don't help provide high-quality picture. So they can show that the entire unit is suffering from anxiety and depression, and of course this is not true. Or then they show that nobody is suffering. So it depends more on the attitude. This is not always happening in the same way, but very often. So it would be good if we have more of case studies like of case studies of these situations. Thank you. Well, people are very silent today for some reason, and expecting that somebody has to do something, but we are 40 people who have gathered here to discuss different things. Andrew, can I ask you a question? What format of research, of survey do you expect? Are these tests, paper tests, or online? If we talk about polling or screening research, if this is a clinical structured interview, this is one thing, but we don't have so many opportunities among military psychologists to do it with the clinical experience and those who know how to identify different states. Very often we are using questionnaires, and they don't always provide the correct picture of the mental health state of military staff members. Well, as for the format of diagnostics by voice, is it interesting? Yes, probably it is, but I haven't tried it before. Maybe you can share it with us so that we can try and test it.
Are you saying that screening isn't working in the Ukraine armed forces? I'm seeing head nodding. That would be like a really wonderful case study to talk about. You know, you can do case studies on programs as well, because I will tell you that in, the US, Canada, Australia, other countries, screening is like the norm. And we all know that the validity of a lot of these screens outside of primary care, are questionable. Let me just say it that way. So just hearing your experience of what you're seeing, as just
we have just a pilot very useful. We have just pilot study about use with application, and we receive few results, few dates of results. Yeah, and after that we will share this information and improve this application.
And one of the lessons learned could be like in one of the like a total global, national war, there's just not enough resources to do it, right? I mean, I heard that come out. So there's lots of different challenges to doing, like this kind of extensive behavioral health care interventions, because screening is an intervention. And we have to be mindful of the resources it takes to do that, and whether or not it could be pushed down to non-professionals, whether, who actually can do it. At one time in the U.S., we had technicians, enlisted doing screening, and then the U.S. said, no, we want a licensed clinical provider doing all the screenings, those kinds of approaches. So, and you can do that if you have the resources, but if you don't have the resources, then that's just not a possibility. So there has to be alternatives. You just not do it. Do you do it differently? So these are all this would be a great sort of case study at sort of like a program level case study. Kurt gave some wonderful examples of clinical case studies, but this would be like kind of one up from that, at a program level that's just equally important to document. And I know that Amy would be, I hope you submitted this to Amy's special issue, because I know she would be very, very interested in that topic. So I'll shut up, but thank you for sharing that.
You're welcome. We will try.
I may ask a silly question, excuse me. Isn't that a quantitative research? If measures don't work, if diagnostic tools don't work, then probably we should collect data from the personnel, right, whom you have measured, and then you show that, no, it doesn't work. Like all the brigade, let it be, are anxious, right? Or all the brigade have PTSD, score high on PTSD. Isn't that?
Yeah, well, like what, Oksana, that is such a great question, because what do you do if 100, like, remember, I'm just thinking back to the lectures on mild traumatic brain injury, where you guys basically said that's 80% of everybody. If we can't take 80% of everybody and give them, 90 days to recover, it was just not doable. So what's the solution, right? And we didn't really give you guys any help in working through that, right? We gave no help. We just said, oh, well, this is our process, right? And so we already know that our process for treating traumatic brain injury won't work if we have a sort of global sustained conflict. I'm thinking like this special issue that Amy's doing. We already know it won't work. Our people in our center, who study this, are they working on what are we going to do? How are we going to implement that? And this is where, as Jim was saying, we can learn, well, what are you doing? Do you just say, forget it? You're still going to the front line? Probably. That's what I would probably say in a nutshell what we do, right? Maybe the more severe cases of mild traumatic brain injury, which is kind of an oxymoron saying you have severe MTBI. But maybe in those cases, they would get assigned a different duty on the front line, but it sounds like that's what you guys are doing anyway. And that would be an important lesson learned also to note, like, what do you do when the process, because I will tell you, a lot of the things we put in place during the wars in Iraq and Afghanistan were based on having lots and lots of resources, even though at the time behavioral healthcare folks were thinking there's not enough resources. Comparatively speaking, we had a very, very robust set of resources to put in place these processes. But what do you do when you don't have the resources and the luxury of giving people 30, 60, 90 days respite to recover. But you have to live that, and you've done something. You are doing something. I'm not saying it's ideal in the long term for the individual, but it is what you're doing. And there's lessons to be learned there. Oftentimes you can't do ideal. You have to do what needs to be done, and then you'll worry about it on the back end. That's never a good idea if you can avoid it. But when you're in a desperate situation, I'll use that word desperate very loosely, you do what has to be done. So these are the kinds of lessons learned, I think, that can be shared. And I said there may or may not be quantitative data, because when you show someone that screening is not effective, there's always a complaint. Well, you didn't do it this way, or you didn't do it that, you didn't consider this. Like, I've been there on the front line of all of these debates, a decade ago. And we still did them, by the way. I understood the limitations and of screening, and what is it you can get out of it. But at some point, the commander said you're going to do it, so you try to do the best you can, given that you were ordered to do screening. I will tell you, if it was left up to behavioral health care providers, psychiatrists, psychologists, so we never, ever, ever would have done mental health screening in the U.S. ever. It was ordered from the top down, and that's why we did it. Actually, it started by being ordered by Congress. Our Congress said, you will do screening, and actually it was screening coming out of Bosnia. And then, of course, that grew and grew and grew to now where we do annual periodic health assessments, which I think is a good idea, by the way. And the periodic health assessments are a good idea. And so a lot of these ideas aren't coming from the experts. It's coming from Congress or general officers saying, we're going to do this. I want you to touch my soldier. I want you to see how they're doing, those kinds of things. So, and that's it may be a very, very different environment in what's happening in the Ukraine. So if you're not being ordered to do it by someone, then you can kind of take a step back and say, well, maybe we're not going to do it. The UK, for example, doesn't do screening. Because they did the studies and showed it's not effective, and their commanders don't care if it's done or not. So every country's different, right? Every country's different. But the lesson learned, I think, can apply across different countries. Doesn't mean the U.S. will stop doing screening because we have resources to do it, but it does point to not everybody does it, and it doesn't mean you're not providing the best care. It just means you're not doing screening. So.
I would add to that, again, as you pointed out, the situation in Ukraine is unique, quite different from what we've had to deal with in the United States, and it is a precursor of what we fear for the future.
And there we have to say, look, we don't have the resources to do it. We go back always to World War II when we talk about mental health screening. And, when we did psychiatric evaluations of every recruit that joined the Army during World War II, we ended up excluding from military service for psychiatric reasons about a third of all draftees. 1/3. And then guess what happened, Oksana? All of a sudden we ran out of people. We ran out of people to put on the front line. So we got rid of all of that, and we brought them in anyway. And for the most part, they did okay. I'm not going to say it was a universal success and everyone that was excluded did well. That would be inaccurate. But for the most part, they did okay. And from that experience, everyone became anti-screening, right? So it took a while, 50, 60 years for folks to say, well, why don't we give it another go, all right? But it wasn't a screen necessarily to get them into the military. It was a screen, say, coming back from deployment to see if they had any mental or behavioral health issues, any physical health issues, etc. So, screening can serve multiple purposes. It's not just, here's the only reason why you would do screening. It can serve multiple purposes. So there's a lot of nuances and subtleties when we talk about screening. And so I don't want to say screening is bad universally. It depends on where you're doing it and for what purpose you're trying to do it. And I think if you define those purposes in a particular way, screening can be useful. If it's just to give every soldier an opportunity to self-identify, I think screening can be useful. You have to weigh whether or not you have the resources to do that, right? If it's a way to reduce the stigma because you've routinized screening and asking about mental health and behavioral health issues, then that could be useful. But again, where's the data that supports that that's actually being achieved? So that's where it becomes a bit trickier. I see lots of hands up, so I'll shut up.
Yeah, finally, we do have hands. Володимире, кажіть. Так, це у мене інтернет, ні, вроді всі рухаються. Володимир, чуєте мене?
Volodymyr, do you hear me? Over to you. Probably there is some problem with connection. So, Sergey, over to you. Good evening. I have a question to Carl. Have you ever encountered in US that soldiers got better screening results to stay less time at the recovery? So they would lie during the screening. They would say that they are okay to get faster back from the recovery time. Thank you.
Well, so you asked a very important question. So one of the important things we never did in the U.S., at least while I was on active duty, I don't know if they do it now. My guess is they don't. We never screened soldiers before they deployed, only after they come back. So it doesn't get you out of anything, right? Because you're already home. And my guess is that if you did a screen before deployment, that you would see this big spike of folks identifying problems. Now, some people might say, well, they're just faking to get out of deploying. But we do have research, a study, it's kind of an older study, that shows that as someone who's like been in combat or has, when they're getting ready to go back, they have this increase in psychosomatic symptoms that's related probably to the experience of deploying to combat. So I don't think the symptoms are fabricated. I think that's real. Interestingly, what you don't see is this increase in psychosomatic symptoms in people who've never been in combat before. So it's clearly based on some experiential aspect of the deployment. But, you know, there's always this, and then there are some folks who kind of just were, you could just imagine, were just kind of hanging on, trying to deal with issues on their own without getting help. And then as they're going back, they realize, I really do need help. And, you know, but we deliberately did not screen prior to deploying. And I remember being asked by a newspaper reporter, do you ever deploy soldiers a second or third time who have post-traumatic stress disorder? All right, that's what they asked me. And I said, absolutely we do. And they were kind of like flabbergasted that I would say that. And I said, but I don't know who they are. But I just know what a normal distribution looks like. And I know that we are sending people who would have screened positive on a post-traumatic stress disorder screen into combat. Now, having said that, I said you have to recognize that individuals can still be very high functioning and suffering from a variety of mental health disorders. Okay, so just because you have post-traumatic stress disorder doesn't mean you are totally debilitated and you can't function. And I'd like to think that a commander and leaders wouldn't be taking soldiers with them into combat, knowing that their lives depended on everyone being able to do their job if these soldiers weren't functioning. Okay, now that's a big assumption. Admittedly, that's a really, really, really big assumption. But at some point, you can't self-select out of doing your job, right? There has to be some evaluation. And And that's why it's really, really important that that you have a rotation system, and we talked about this before, where soldiers can recover and get care that they need so they can continue to function. You can't just put people on the front line for 5 years or 3 years or 2 years with no significant break and expect them to function. It's just not reasonable in any scenario for that to happen. And that's, and Jim and I talked about that before. So, but it's really tricky. It's really tricky. Some of these issues are really, really complex. There are ethical issues involved in all of this. Is it ethical to send someone to combat who's already suffering from the trauma of combat? Is it ethical to do that? All of these things I don't have answers to. Each country will come up with their own solutions. We grapple with them ourselves. We don't have like answers to these things. We have, here's what we do. But all of these issues fundamentally come in what is in the immediate best interest of the military, and what is the immediate best interest of the individual. And we're constantly trying to balance what's best for the military mission and what's best for the individual, both short-term and long-term. Okay, so those are, and I don't have the answers to those, but these are the issues we want you to grapple with in this, in the publications and in your lessons learned. So I'll shut up again. Go ahead, Jim, and I see that a lot of Mark.
Let me just add to the complexity with an example, maybe a large case study. In America's involvement in the Iraq War, first Iraq War in the 1980s, when we deployed literally thousands of soldiers from Germany to Saudi Arabia to get ready for the Iraq War. I can assure you, few if any soldiers wanted to be left behind in Germany. Everyone wanted to go. They did not want to miss this opportunity. And that's how they saw it, as an opportunity. And so it was sort of the opposite problem. It was commanders learning how to say no to soldiers whose own health might jeopardize or risk aspects of the unit. And I suspect the same is true even today in America's more elite forces. When it comes time for some major activity, again, the issue is not so much who wants to stay behind, but who doesn't want to stay behind. And it's a challenge for commanders, just as you described. And again, that would be a wonderful kind of article if somebody is working with leadership to talk about how commanders try to deal with those issues, even on a personal level, in your consultation with leaders. So again, I'll be quiet from there and encourage others who may want to comment. But the situation is important to understand, the context in thinking about any of these issues.
Володимире, як тепер? Чуєте?
Volodymyr, over to you. Do you have a good connection now? Yes, thank you, Carl, for this very interesting example. With this brain trauma that is very widespread, and that the screening doesn't make sense. Also about psychological state that we've been talking with Andriy, that traditional methods that are used today for screening are showing like a high level of anxiety, depression, PTSD, and correspondingly they are not the proper tools for selection of the people who are who have like worse states, and they are not applicable for combat action. My case is when we as volunteers come to the unit. Normally it's small unit like a battalion, and we have enough people to work with them to help them with recovery after the combat action. We don't do individual screening. We do firstly, we talk to leadership what they think, who needs the individual attention from the unit. Secondly, we do screening modified by Oleg Boyko. It's a psychological assessment for combat action, and it includes not only the assessments of symptoms of psychopathological or like level of anxiety, but more of like trust to the commander, if they are satisfied by the conditions. It's like more general than a psychodiagnostic. But it estimates the psychological readiness to participate in combat action. But we do it on the level of the unit, not individual. So this type of work with the unit works for us, because that's how we can communicate to the whole unit. And also find out who needs individual attention for individual recovery. And it all depends on the circumstances they are in. And if we are talking about people who are going through the recovery, we have 2 therapists who can work with them. And we have 10 to 20. We can send 10 to 20 people for the recovery, but we have to select them, and we need tools. Psychologists need these tools to find out who specifically need this time for recovery, how to find those people who really need this recovery from thousands of others. Like maybe we should do some like individual consultations, or because there is normally among them, like there are people who need this like individual recovery time. We try. I think it's very hard to do like the assessment of each individual because it needs too much time. And we need, I think, some shorter instrument. It's some shorter tool for that. So we created like 10 question like form. It would be nice if it's going to be like short questionnaire, so it will not take too much time for the military to fill it in, and then we can see. So of course, like if we are working with a unit, like everybody is tired there, everybody is anxious, but some people can function in these circumstances and some people can't. And that we want to see, and this thing like normally officers see, and they can show us, like point those people who need this support. Because and sometimes people during this questionnaire, they feel in the form like everything's fine, but they really are like not fine, and it's only like that the commandment can pinpoint those people and show who like really needs this like individual recovery support. And sometimes people don't need a long time, sometimes they need like 7 days, 3 days, like short time for recovery, but it is very helpful too. And we are looking for these tools, how to quickly find those people who needs it. So are you asking like something about the creating this like assessment form, or what?
Something that may allow us to evaluate the functional state. Well, we are not asking people, do you think that you're not okay? Of course, they will say yes, but we may ask, how many times you missed cleaning your teeth during the last 2 weeks? Carl, Jim, maybe you have any ideas about some tools to evaluate people by way of functional screening or something like that?
I am not personally aware of any, and as you describe the situation, I always return back to the importance of leaders knowing their people and recognizing those individuals who, regardless of issues of anxiety, depression, whatever, are able to function and maintain their role in the unit, and those who are, if you will, a danger to themselves or others. And so, I often think about the importance of your conversations with leaders. The second part of this, and this is maybe a different conversation, is how we think about, if you will, rotating small groups of people, units, squads, platoons, out of combat for a period of time for rest, recovery, reconstitution. And again, you may not have the manpower to be able to support that kind of model. But I think many militaries understand the importance from a perspective of morale, cohesion, and leadership to be able to do that at various levels within military organizations. When a group of units, again, have reached their maximum capacity in terms of dealing with the stress of combat. And when those units, if you will, are becoming less than functioning, less than operational, and need to be rotated and restored, whether that's in terms of physical or mental health, or whether that's in terms of numbers of people in key positions because you've lost soldiers for a variety of reasons. I hope that's helpful.
Thank you, Jim. Yes, we use rotations of units or rotations of smaller subunits. And I fully agree that the main thing is the decision of the commander who knows his people and who can identify those people who need help. Right now, I think we are trying to look for a screening tool that would compensate the gap in the mental health competences of the commanders. So in usual conditions, and in any case, this is our main task, is to improve the training of the commanders, of the leaders, and to help the leaders get the competences to communicate with the staff so that they should know their people better, to be able to recognize their peculiarities. And many leaders really work this way. But there are some commanders who can say, you are the psychologist, you have to do something, you have to diagnose people. But of course, this is not correct. But maybe here we have colleagues who can say what you are doing. You can tell us about your impressions and your work, and maybe it would correspond to the real practice.
It would be interesting to learn more about behavioral kinds of assessments rather than per se psychological assessment. So here I'm talking about people's ability to perform important daily activities or functions. And so I won't say any more than that. Kyle, you may have some things to add, or Kurt, you may have some things to add. But it strikes me that focusing on core behaviors and ability to function is maybe the easiest or most critical thing to think about. So maybe from our Ukrainian colleagues, what thoughts do you have? I'm answering my own question, and the one area that I keep circling back to is sleep, and the ability to get restorative sleep.
Я б, знаєте, спитала, я, напевно, українською мовою
I
скажу,
would
чи
ask,
сама перекладачу, у нас же є перекладачі,
I
цю
will
різницю
ask it,
між
I will say it in
кількісним
Ukrainian.
дослідженням і
So
потім
we have
секцією
this difference
discussion,
between the
обговорення, і,
quantitative
власне, кейс стадії. От
research,
я
and
зараз
then we have
слухаю,
the
я думаю,
discussion
тут
session
для
and
себе
the case study.
розрізнити,
Right now,
чесно
I have been
кажучи,
listening.
колеги,
It
які
was
з
difficult
досвідом
for me to
публікацій поділитись.
differentiate.
Мені так
Maybe our
звучить,
colleagues
що
can share their experience
це
of
таке кількісне
publications.
дослідження, яке потім в
So for me,
обговоренні
it seems that we have a quantitative
містиме. І, в общем,
research,
там будуть висновки про те,
and
що
during the
ну,
discussion,
там те і
there
те не
will,
підходить,
during
те і
the
те незручно, непомічне.
discussion, we can see that
А
these
ми
or that
обговоримо кейс
things
стадії,
are
і тоді
not
як?
relevant,
В чому ця
and we are
різниця?
sort of discussing a case study. So it's difficult to understand the difference.
Це ви питаєте про
So are you asking?
Стосується чого?
Наприклад, тієї ідеї, яку Андрій
What
каже,
are you
так, оцей
asking about?
асесмент,
Well,
про те, що
Andrei has
воно
the
не
idea
працює.
of
Цей
assessment,
асесмент,
and
який наразі є, що
Andrei
воно не
says
працює.
that the
І
current
мені так видається,
assessments
що
do
для
not
того,
work well.
щоб ну, так стверджувати це в
It seems to
публікації,
me
потрібно назбирати там
to state
якихось
this in the
купу
publication,
цифр
you need
умовно,
to
та,
collect
показати, що
different
так просто не
figures
може бути, що там
and
умовно
to show
80%
that it is
людей,
not
які...
possible that
Так,
80% of
Ну,
people who,
я би собі
well,
так уявляв, що
well,
це
this is clear. As far as I understand,
там батальйон написав,
for example, we have research when the battalion has adaptivity of 200, they have filled out all the methodologies, and the research shows that everybody is bad or everybody say that they are well, but at the same time we have this specific case and that specific case. So we have a specific service member that shows this picture according to the methodologies. Or if everybody say that everything is well, we have two persons who have acute stress reaction, but others, all the others are functioning well in spite of all the mental health reactions, as we have been discussing. There are no behavioral impacts and they continue to function. And this shows a big difference. So we may have some specific clinical observations and we may use them as cases to illustrate this. And we can show this case and in the background we can say that it was not revealed by the screening or traditional methodologies. And maybe some people have other tools, like we have prepared a Google form, or Mr. Hulkovsky has come up with other more sensitive tools that he is using in a group or that allow to show the development in the dynamics, to show the real practical experience. So for me, case study is when we illustrate the specific experience. And the authenticity of a case study is that we can show that this was a real case. But when we have a quantitative research, we have a cohort, and we need to validate this to show that we have not made mistakes in the data collection. But when we have a case study approach, it doesn't show that everybody is in the same situation, but we know for sure that in one particular case, this is what happened. Or vice versa, if we see something unusual that doesn't correspond to the traditional assumptions, and it is exhibited in one case, and this is not the PTSD, not the acute stress disorder, not a panic disorder, but this is something different that nobody has ever seen before. For example, very often it happens that one case helps to start discussion of an issue. For me, this is a topic of people who have certain mental health disorders, and at the same time they are able to cope well with their military work and combat work without supportive treatment. In the beginning of the full-scale invasion, these cases were, of course, strange and arouse respect. But now we can see that these cases are not so unique. But anyway, how does it look in the practice of military psychologists and medical professionals? Because we may find different cases to illustrate this situation, successful and unsuccessful ones or specific ones. By the way, this is yet another phenomenon that we can describe. So people with mental health disorders and how efficient they can be in combat. And as Andriy has mentioned, and you, I'm sorry, I'm talking about my own topic. As we say, we have some extreme cases. Well, we have a general tendency, and then we have some extreme cases as well. And so in the case studies, we pay more attention to the extreme cases. Well, when we in the research, when we try to normalize the results, we cut off some cases, but in the case study, we can research a particular situation and maybe make a conclusion what that was. Maybe it was a mistake, or maybe it was a peculiarity of a person, or something that was non-standard because of the genetics. Or maybe this is a new phenomenon that has just appeared and needs explanation. Kurt, please.
I think your examples, they bring up an excellent idea for a collection of cases, particularly with this topic of using instruments to screen for conditions. And I'm assuming these are patients that are coming in for help, but looking at instances where I would say in particular, think about your practice before the war and what you would allow that person to do with those results. And a case where somebody came in now and they give results that 3 years ago you would have considered very alarming or concerning, but now you see them and say, that person is not as ill as I would have thought. And yes, they should be out there and they want to be out there doing their job, and I let them go do their job. So that's the kind of thing I think that is helpful to inform other therapists, especially as they're, because I am saying this from a presumption that there are many therapists that are now working with soldiers that didn't used to. And so they're learning what it's like to work with soldiers. So writing this down and sharing that so that they can see it and read it and say, I saw that too. Oh, I made the right decision.
Colleagues who posted on the chat, maybe you'll do some comments.
I will just add to Kurt's comment and what Jim said. Screening is not science. There's an art to screening. All of the challenges that you've identified as identifying individuals with issues, not identifying with clear issues, the specificity, sensitivity issues are all, that's what everybody sees. That's what everybody sees. There's nothing that I can say, here you go, use this one. This one's perfect. It will suit your needs. That screen does not exist. I just want you to recognize that. That screen does not exist. And, this is where, your own experiences, your own context that Jim mentioned, How you go about that will be very, very specific, and it still may not be ideal. But I do want to highlight something that Kurt typed in the text section. I think any issue that arises that gets at the ethical issues of being a psychiatrist, being a psychologist, being a social worker, the ethics of care versus the mission is really important. That, and capturing a few case studies of how those were handled and navigated, probably to no one's satisfaction, would be hugely informative. You know, case studies, I know Kurt gave this beautiful case study with a beautiful outcome and the beautiful what we could take away from it. But a lot of times case studies leave you feeling uncomfortable, and it doesn't tidy things up. It's still messy. But that's how we move forward, is just recognizing things aren't ideal, but this is how we did it. And people will say, I can't believe you did it that way. I would have done it this way. Great. You could try that and let me know how it works, right? That's how we learn. It's, you know, and I know that a lot of this, sometimes we don't write things and publish things because of the ethical issues involved. But it would be great to sort of get that information. So. And I know you all have experiences. And I know we talked about soldiers, you know, who are doing the fighting. And of course, that's really important. But I don't want to forget the families. For those of you who are working with families and children, any lessons learned there on how to sustain families and sustain children is equally important. And I think very, very much of interest from the U.S. side, certainly from my personal perspective. I think it's really important. So I don't want to lose the side of families as well.
I'll add that Oksana has posted or will post another journal opportunity that's really focused on families and children for any of the participants here who have an interest. And again, glad to be of assistance if anyone wants to consider that particular publication.
I also just want everyone to note that I have to leave. I got a hard stop in 10 minutes, and I apologize for that. If the conversation goes on, you just may see me drop off. So I just want to alert folks that I will be dropping off in like 9 minutes or so. But I have found this conversation very, very useful, and I hope everyone else has as well. And at least to get you thinking about, you know, the clinical aspects, getting focused on the social aspects, even, you know, specific issues like screening. You know, it won't work not in this context. You know, it's just not enough resources, or it's just not effective, right? I mean, all of those things, right, could be why, you know, it's not effective and it takes a lot of resources, so we don't do it. I know that's the UK's position. I'm summarizing, but that's their position. It takes a lot of resources and it doesn't do what we want it to do, so we don't do it. Full stop. And other countries are taking different approaches. So I don't want you should feel like there's something out there you're not using. Our approach to managing mild traumatic brain injury probably isn't doable either. I don't think it's doable on the U.S. side in a larger conflict either. So these things will sort of get dealt with on, or we could think about it ahead of time, or we can just respond when we say this is not possible. And, you know, so there are lots of approaches, but the idea is to the idea of a lesson learned, by the way, is you think about it now before you need to implement it, not you think about it when the disaster's in front of you, right? That's the whole point of a lesson learned, is you don't have to react, you already have a plan in place. But I will tell you, having said all of that, even from the U.S. side, we often respond because the plan we have is not going to work either. Okay, so I mean, that's just the nature of sometimes how we plan for the future. You know, the old adage, We planned for the last war we just fought, not for the future war that's likely to happen. That happens all the time because that's what we know. And it's easier to plan for things that you've just experienced versus things you're anticipating.
Колеги, прошу, у нас залишилось зовсім трішки часу, якщо є питання.
Dear colleagues, we don't have too much time. Maybe if you have some questions or some comments, please.
Yes, Jim, please go ahead.
Oh, since no one had responded to your invitation.
Так як ніхто не захотів нічого додати, я можу я сказати щось?
Let me just offer an invitation to all of you.
Тож, можна я запрошу вас всіх?
I have been talking with Oksana and
я вже говорив з Оксаною.
In how you have experienced with soldiers the issue of morale,
щодо вашого досвіду з роботи з військовими
when their own family members have come under attack from
їх сім'ями, особливо в ситуації, коли їх сім'ї зазнали перебувають у зоні бойових дій також.
I'm getting that back feedback from the interpreter. I'll repeat. We have an interest, and again, this speaks to the lack of experience in America of fighting wars where our own home front was under attack. This has been the experience in Ukraine, and we would be very interested in learning more about your work with service members, with soldiers, who've experienced the attack on their own families and civilian communities in Ukraine, and how that has impacted morale and how you've dealt with it, especially. And again, that could be in terms of a case study. You work with a particular soldier whose family has been threatened or come under attack or been harmed, and how you've worked with that soldier. So if you have any interest, contact back with Oksana and we'll arrange to talk. So appreciate that. So turn it back to you, Oksana.
Yep. Колеги, у нас 5 хвилин. Якось небагато активності.
Dear colleagues, we don't have too much time. Unfortunately, I think all of you are now thinking about your cases and what do you want to talk about. Or we have some noise. And please contact us if you have any questions about how to edit this article of yours. I will add in the chat the links that Jim offered. I've already posted few. We have some new participants coming, but we already have like only 5 minutes left. Jim will give us more links. Please, dear colleagues, share your experience, and you're gonna be heard here because you have like this very important experience.
I hope that something good will come out of this, even though we didn't have much, activity, but still, I hope that people are processing and they will come out with lots and lots of cases published. Так. Добре. Тоді всім гарного вечора. Бережіть себе.
Have a good evening. Take care.
Thank you.
Thank you, everyone, for your participation. And a special thanks to Kurt. Thank you so much.
Yes, exactly. Okay.
Дякуємо всім.
Thank you to everybody.
Дякую.
Дякую. Всім пока, дякую.